For some very select patients, there are some additional options for interventional or surgical therapies for COPD. For those patients who have giant bulla where their more normal lung is kind of being compressed, you can do something called a bulectomy, and I'll show you a slide of that in a second, which gave rise actually to lung volume reduction surgery. So in the open procedure of lung volume surgery and bulectomy, what they do is they open up the chest. They actually can grab an area of very diseased lung, and they can pull it up and clip it. And by removing that bulla, it actually improves the elastance of the lung, and it gives people sometimes, you can see that by a little bit of unflattening of the diaphragms. And what it allows is more opportunity for the normal lung that exists, or the more normal lung to function. LVRS is a condition that can be done through, or a procedure that can be done either via open or through endobronchial valves. There are several valves that are now available that you can have an interventional bronchoscopist go in and place these valves. And functionally what they do is they end up leading to little areas of collapsed lung what that does is that does the kind of similar thing to removing areas of diseased lung. And then lung transplant is actually becoming more and more common. When I was a fellow early on, the median survival was probably about 2 years. Now it's well over, I think it's closer to 7 years. And so lung transplant has amazing capabilities on improving patients' well-being. I've sent several patients to lung transplant, and when I send them transplanted, and when I see them in the hospital, the first thing they say is, "Oh my gosh, I cannot believe what it feels like to breathe again." And it's really an amazing story. But like I said, these are really patients who with very kind of advanced disease.